Welcome to This Explainer. As a concerned medical professional, I'm constantly analyzing the data. And today, we need to talk about a phenomenon that is affecting practically every single family right now. We're looking at the sudden, vertical spike in chronic illnesses. Today, we're going to step into the roles of both clinicians and detectives to unpack the source material and uncover a system that, quite frankly, the data shows has fundamentally failed us. It's time to investigate what we're calling the manufactured epidemic.
So let's put on our detective hats for just a second. If you track the historical public health data for conditions like diabetes, high cholesterol, and hypertension, you don't see a slow, natural, gradual climb. Instead, we see these completely steady historical baselines that suddenly, out of nowhere, skyrocket in a near-vertical spike. It's an absolutely shocking trend, and it begs a massive question.
Because here's the thing, human biology just doesn't spontaneously mutate overnight, right? Our DNA didn't just magically alter itself in the late 1990s or early 2000s. So, to understand why millions of people suddenly became sick without their bodies physically changing at all, the source material tells us we have to look outside the clinic. We actually have to look into the corporate boardroom.
Just to help you wrap your head around the sheer scale of this, today over 115 million Americans occupy the diabetes or prediabetes category. That is a staggering portion of the population. But the data reveals something completely fascinating. Many of these patients actually acquired their chronic illness diagnosis not through some sudden physical decline, but literally with just the stroke of a pen.
And that brings us to our first major point, shifting the diagnostic thresholds.
Let's look at exactly how medical panels essentially manufactured an epidemic just by deliberately changing the definitions of what it means to be healthy. Notice how the goalposts were moved for the big three conditions. By simply lowering the numerical diagnostic thresholds for blood pressure from 140/90 down to 130/80, dropping normal cholesterol limits from 190 down to 130, and flat out inventing a new category called prediabetes, panels instantly redefined millions of perfectly healthy people as medical patients who suddenly required treatment.
To put that into perspective, let's look at the real-world impact of just one of those shifts. When that hypertension threshold was dropped in 2017, a jaw-dropping 31 million Americans instantly transitioned to having stage 1 hypertension. Think about that for a second. 31 million people went to sleep totally healthy and woke up clinically sick without a single biological change occurring in their physical bodies.
Now, you've probably assumed this change was based on some universal, rock-solid medical consensus, right? Well, it wasn't. International medical bodies in Europe, the UK, Canada, Japan, and Australia looked at the exact same clinical trial data and flat-out rejected the new lower guideline. They actively chose to maintain the 140/90 baseline, specifically to avoid the very real dangers of over-treating their populations.
And here is where it gets incredibly concerning. We have to address the systemic bias behind these changes. According to data highlighted by Dr. H. Gilbert Welch, the very committee members who vote to lower these thresholds often have profound, direct financial ties to the pharmaceutical corporations. The exact same corporations that manufacture and sell the daily drugs prescribed for these newly minted conditions.
Which leads us directly into the polypharmacy track.
As a doctor, this is the clinical mechanism that worries me the most. Creating patients out of thin air just to hit these lower numbers triggers a really dangerous domino effect. The British Medical Journal even launched a too much medicine campaign because of it. It goes like this. Step 1, you take a new drug just to hit an arbitrary, newly lowered number. Step 2, that drug causes an adverse side effect in your body. Step 3, suddenly you're prescribed a second drug just to manage the side effect of the first drug. You are now officially trapped in a vicious escalating cycle of polypharmacy.
So if arbitrary numbers aren't the real problem, what is the true culprit? Well, it's high insulin.
Instead of chasing these shifting numbers with more pills, we have to look at the actual biological pathology causing our bodies to degenerate. The real driver linking your high blood pressure, your abnormal cholesterol, and your high blood sugar isn't a deficiency of prescription medications. The source material points clearly to chronically high insulin, a condition known as hyperinsulinemia, and its primary trigger, our modern diet, which is absolutely packed with refined carbohydrates, processed starches, and liquid sugars.
This isn't just abstract. High insulin causes real, physical damage. Think of your blood vessels like elastic pipes. High insulin degrades a vital molecule called nitric oxide, causing those pipes to stiffen and lose their elasticity, which physically drives up your blood pressure. At the exact same time, this excess insulin dysregulates your liver, forcing it to overproduce LDL cholesterol, and it burns out your cellular receptors, leading straight to insulin resistance.
So how do we fix this? Let's talk about stacking lifestyle medicine.
As a clinician, I really want you to know that you are not powerless here. You have the profound ability to take your health back through evidence-based non-pharmaceutical interventions. The challenge is that standard pharmaceutical trials, randomized controlled trials, are only designed to test one single variable, like one pill at a time. They fundamentally fail at measuring complete lifestyle overhauls. So instead, we must look to stacking lifestyle medicine. This means using multiple natural behavioral interventions together to produce a massive compounding effect that heals the actual root cause of the disease.
And the clinical trial data on this is incredibly exciting. By utilizing structured lifestyle interventions, specifically low carbohydrate protocols and strict caloric management, 46 out of 100 participants completely clinically reversed their type 2 diabetes within 12 months. Let that sink in. They didn't just manage it with a handful of pills, they completely reversed it. And we can absolutely apply this stacking method to avoid the polypharmacy trap for other conditions too. To naturally clear circulating blood fats and manage hypertension, the clinical evidence heavily supports stacking specific nutraceuticals. Things like red yeast rice, plant sterols, and high-dose niacin, which actually reduces LDL while elevating your protective HDL. You stack those with powerful behavioral habits like consistent resistance training and a carbohydrate-restricted diet.
So I want to leave you with this one provocative thought from the sources we've unpacked today. Under the fundamental ethics of informed consent, before you accept a lifelong label as a chronic patient, and before you agree to a cascading protocol of daily pills, shouldn't you demand the right to explore the compounding power of your own lifestyle choices first? It is your biology, and the power to heal it might just be in your hands, not the boardroom's. Thanks for joining me on this explainer.